shift, the stakes are high. The Mag breaks it down, no need to sigh. From EU rules to global news, Reg with Mag, your trusted views.
Welcome to Reg with Meg's weekly regulatory roundup. This week, we're diving into a significant update from the FDA that anyone in the medical device space needs to be aware of.
Absolutely. On December 3rd, 2025, the FDA issued an updated final guidance document on its eCopy program for medical device submissions. This isn't just a minor revision, it's a critical update that replaces the 2020 version and has some major implications.
Right, and the central theme here is all about preventing submission delays. The FDA is really emphasizing proper formatting, and this new guidance clarifies how the long-standing eCopy program now aligns with the newer eSTAR program.
Exactly. It's all about pushing manufacturers toward a more streamlined digital process through the online CDRH portal. But, and this is the big but, if you don't adhere to the new rules, you could find your submission in serious jeopardy.
So let's break that down. The first major point is that integration between eCopy and eSTAR. What does that relationship look like now?
The guidance makes it crystal clear. eSTAR is now considered the standard for submissions. It's the present for many, and it's the future for all.
The current standard.
The eCopy program, then, is essentially reserved for those submission types that have not yet transitioned over to eSTAR. The good news is that both formats can now be submitted through the same gateway, the CDRH Customer Collaboration Portal.
That's a helpful bit of consolidation, at least. One portal for everything. But it really sounds like the primary message is get on board with eSTAR if you haven't already.
Totally. The transition is very much in progress, and this guidance is another significant push in that direction. The FDA is also strongly recommending its own free optional tools to help ensure compliance before you even submit.
Okay, so let's get to the consequences. What happens if a manufacturer doesn't get the formatting right? You mentioned submissions could be in jeopardy.
This is probably the most critical takeaway from the entire document. The guidance states unequivocally that submissions with an invalid eCopy or eSTAR format will be placed on what the agency calls a format hold.
A format hold. That sounds ominous.
It is, and here's the most important part. When your submission is on a format hold, the FDA's review clock does not begin. It's frozen.
Wow, so all that time you're waiting, thinking your device is in the review queue, it's actually just sitting on the sidelines, not moving forward at all.
Precisely, and you have a limited time to fix the formatting problems. Manufacturers are given 180 days to correct the submission that's on hold.
And if they don't fix it in time?
If you miss that 180-day window, the submission will be considered withdrawn and closed by the FDA. You would have to start the entire process over from scratch.
That's a massive potential delay, a 6-month window just to fix a technical formatting issue, and if you miss it, you're back to square one. That could be absolutely devastating for a product launch timeline.
It really underscores how seriously the FDA is taking these technical standards now.
So let's talk more about that mandatory transition to eSTAR. The guidance specified certain submission types, correct?
Yes, this is a key component of the shift away from the legacy eCopy system. For instance, all 510(k) submissions have been required to use the eSTAR template since October 1st, 2023.
Right, so that's been the reality for a while now, for anyone submitting a 510(k).
And looking ahead, de novo requests will also become mandatory through eSTAR beginning on October 1st, 2025. The scope of eSTAR is constantly expanding.
So the eCopy program is truly for the remaining submission types that have not yet been assigned a mandatory eSTAR transition date.
Exactly. Think of it as a legacy pathway. Its use will continue to shrink as more submission types are onboarded to the eSTAR system.
Okay, so whether you're using the eCopy pathway for now or just want to understand the FDA's expectations for digital submissions in general, let's get into the technical details. What are some of these updated standards?
They've laid out some very specific and very strict rules. First on the list is file size. The total recommended size for an eCopy submission should be less than 4 gigabytes.
4 gigabytes. That's fairly large, but for complex devices with extensive testing data and imaging, That's a ceiling you definitely need to monitor during preparation.
For sure. Next is file naming, and this is a classic area where people make mistakes. All PDFs must start with a three-digit prefix. For example, 001 underscore document name.pdf.
Ah, yes, the prefix rule. Why is that so crucial?
It's all about ensuring the correct loading order for the reviewer. The system needs to know which document to read first, second, third, and so on to make sense of the submission. Without those prefixes, the entire file could be jumbled and considered invalid.
That makes sense. It's a simple rule, but so easy to overlook if you're not meticulous. What about the content within the files?
There are a few key requirements. First, all PDFs must be searchable. The days of submitting scanned, non-searchable documents are over. The FDA reviewers need to be able to find keywords easily.
Of course, so no saving documents as flattened images of text.
Right. Also, they must not be password protected. The FDA needs immediate and unrestricted access. And finally, the file names cannot contain any special characters. Stick to letters, numbers, underscores, and hyphens to be safe.
These all sound like basic digital file hygiene, but when you're compiling potentially hundreds of documents from various teams, it's easy for one incorrectly named or protected file to slip through and derail the entire submission.
Totally. And one last technical point, the submission method itself. For those submissions going to the CDRH, you can and should use the online portal. However, for other submission types, the guidance still allows for physical media, a CD, a DVD, or a flash drive.
So, even in this digital first era, you might still be mailing a physical flash drive to the FDA. It's critical to know which submission path your specific device type needs to take.
So when you piece it all together, this updated guidance is really a line in the sand for the medical device industry.
How so?
It's the FDA formally stating that digital readiness is no longer optional. Strict adherence to specified electronic formats and alignment with their digital systems are now fundamental prerequisites for an efficient review process.
The goal is efficiency for both the agency and the manufacturers. A perfectly formatted submission gets into the review queue faster and moves through it more smoothly.
Right, but the flip side is that an improperly formatted one doesn't get reviewed at all until it's fixed. The risk of significant delays has never been more directly tied to these small technical details.
And navigating these evolving requirements can be incredibly complex, especially for small to mid-sized companies that might not have a large, dedicated regulatory team monitoring every guidance document that comes out.
That's a great point. The ongoing transition from eCopy to eSTAR, coupled with these dozens of tiny but critical technical rules, it's a lot to manage on top of actually developing the device.
It's why having support, whether it's a deeply knowledgeable internal team or an external partner, is so important. You need expertise from someone who lives and breathes this stuff to ensure your submissions are compliant from day one.
Yeah, you want to do everything in your power to avoid that format hold. Having a partner who can help prepare and validate both eCopy and eSTAR submissions to meet those precise requirements must be invaluable.
And not just preparing it, but performing validation and pre-check services, using the same FDA-recommended tools and internal quality checks before it even goes out the door can dramatically reduce the risk of it being flagged.
It's like having a friendly audit before the real audit. It catches the simple mistakes that could cause major delays and headaches down the road.
Exactly. And for companies still on that e-copy pathway, getting tailored advice and strategic guidance on how to make that transition to eSTAR smoothly and in alignment with the FDA's timelines is a must.
So ultimately, it seems like end-to-end regulatory support is the key. From initial planning to final submission, having a partner helps you avoid those delays and maintain compliance. It's about peace of mind.
Definitely. In today's regulatory environment, you just can't afford to get tripped up by a formatting error. The stakes are simply too high. So to recap for everyone listening, the FDA's new eCopy guidance from December 2025 is a must-read. It reinforces the agency's shift to eSTAR, clarifies the stringent technical standards for all submissions, and introduces the very real consequence of a format hold for noncompliance.
Pay close attention to the details.
file naming, searchable PDFs, and submission portals because they can make or break your product timeline. And as always, if you have questions, we encourage you to seek out MedEnvoice experts for tailored support.
And that's our regulatory roundup for this week. Stay informed and stay compliant. Bye, guys.